My name is Jacob, and this is going to be my changing of the mainline IV bag and also a piggyback. So the first thing I'm going to do is I'm going to check my patient's chart, notice for any allergies on that chart, and know that I have to change the bag as well as administer medication of gentamicin. So I have my MAR, I go to the med cart, do a little hand hygiene here. So the first thing I'm going to do is I'm going to pull out my medication. So here we go, gentamicin, 80 milligrams, administered today. So I have the right patient, time, route, dose, medication. So that's good, that's my first check. For my second medication, it's my sodium chloride, 500 mils, the right patient, time, route, dose, medication. So that's good. Everything matches up. So now I'll do my second check before I leave. Go back to my gentamicin and the right patient, time, route, dose, and medication. So that matches up. So that's good. And I'd also want to check if there's any kind of precipitate, any kind of cloudiness, making sure the integrity of the baggage is good, so no leaks. So then my second check for my sodium chloride, the right patient, time, route, dose, medication, it all matches up. Integrity of the package is good, not this, okay, so it's good. And it's expiration date on both of these are good. This was prepared today, this one still is good. So then I have all my equipment. I also need a secondary set for my piggyback, checking the quality of the package and the expiration date. It is good. So I'm going to take this, all my equipment, to the patient's room with my MAR. I'm going to knock on the door. Once I gain entry, I'm going to go to my patient. I'm going to do some hand hygiene. I'm going to introduce myself as a student nurse. My name is Jacob, a student nurse. And your name is, your full name and date of birth, please. Okay. I'm also going to assess his wristband, making sure it is who he says it is. And that matches up with my MAR. So I have the right patient. So I want to explain the procedure. I can elevate this up so his arm is a little bit, so his bed is up so I can see his arm. Providing for privacy, and then I'm going to explain the procedure that I'm going to be changing his mainline IV bag. And also that I need to first assess the site and note he doesn't have any allergies. I would assess if he had any allergies. I would assess his arm, the site. I would ask if there's any kind of pain or irritation. Then I would also look at it. I would inspect the changing of the bandage, the clear bandage, and that's still valid. It needs to be changed later, so we're good on that. There's no phlebitis or infiltration. There's no pallor. It's not red or irritated. It doesn't look swollen or any kind. It just looks really nice and normal. So that's good. I'm then going to trace the base. I'm going to find my tubing. Make sure my tubing is intact. No kinks in it. Everything's good. It's patent. It's good, and it goes all the way up. Okay. So that is good. So next I'm going to start to prepare. Okay. On my gloves. Okay. So once I do that, I've traced the base. It's also important to note that there should be an expiration tag on the tubing. So then we know when to change that as well. But for the video, it only says changing the mainline IV bag, so that's what I'm going to do here. So I did that. So let's get some supplies set up. Open up my bag. Doing my third check here. I have my sodium chloride. It's good. There's no precipitate, no leakage in there. I have the right patient, the time, route, the dose, and medication. So that's good. I'll worry about the secondary second. So that's good. So then we're going to take this thing down. I'm then going to, very carefully, not contaminating the spike, take this thing off. Just got a little twist. Put that away. I'm then going to have my IV bag. I'm going to take that off. And I'm going to spike my bag, going all the way up to the hub. Giving it a little twist. Making sure it's in there. Okay, so she's in there. So that's good. Gonna give it a little prime. Alright. Hang that up. Now I need to do my third check for my gentamicin. I have the right patient, the right time, route, dose, and medication. So that is good. Still no precipitates, not leaking. I need my secondary set for my piggyback, so I open that up. Expiration is good. Integrity of the package is good. And I'm also going to notice the drip rate. So then when I can do my calculations, I will set the appropriate drip rate. So I have my little hanger here, hang that up. I'm going to clamp my tubing here. Let's move it up a little bit. Okay, I'm going to clamp that. Okay, and now I need to spike my medication, so I need to take that off. I'm going to take off my cap, and then I'm going to insert the spike, a little twisting motion, going all the way up, so that's good. And it has been spiked and it has been clamped, so we're good. So I hang up my medication. Okay, now I got that port right there. I need to clean the port. So again, alcohol wipe. Alright, making sure that my clamp here is close by. I'm going to clean my port. This thing has been clamped as well. So I'm going to clean that really good for 10 seconds or so. Okay, set that down. And then I'm going to remove the cap from there, and then I'm going to just insert it, and then slide my cover right over there and give it a twist. So they're connected. Now I need to prime my my secondary line. So I'm going to take this down. Alright, I'm then going to release this clamp, and then I should, there we go. So that's good. There we go. Now she's going. Let me make sure there's no air in it. Alright, I got a little too much of my drip chamber, so I'm just going to squeeze a little bit back into the bag. So more about half. Okay, that's half, so that's good. So that's good. This is clamped still. So I need to lower my main line, because I want my secondary to run. So this is going. Okay, so that's good. So then I'm going to open up my secondary, and then this is where I would set my drip rate with this one. So I would just kind of would know my drip rate. I would slowly open this up until I got my drip rate there. And I would set my drip rate, and I would also note that if it's the same drip rate, then I can just let it go at the same drip rate, but I would need to monitor this closely if these two are different drip rates. So then once that's set up, I'll let that go. I don't want any of my IV on the floor, so I'm going to kind of hang it up. It should work. I'm going to take off my gloves, do hand hygiene. I'm going to document on my MAR. I'm going to make sure that I come back in the appropriate amount of time once my medication has been instilled or before to assess my patient, because I need to know, obviously I need to know the effects of the drug, the side effects of the drug, the appropriateness of the drug, any nursing indications I need to do for the drug. So it's important that I do that. I would document that. I would document how well he took that. And I would also make sure my patient is comfortable. Anything else that I do for him, he's gets call it well within reach. I can take the curtain back so it's a little more open for him. And then I would be back and assess my patient at that time. And that's my video.